So just to introduce myself a little bit, I'm Dr. Maggie Liang. I am a GYN oncologist here at University of Alabama at Birmingham. We have a group of 6 providers, and we really care for focusing on medical and surgical care for patients with uterine, cervical, ovarian, vulvar, and vaginal cancers. So outside also of seeing patients, one of my sort of clinical and research interests is on this topic, financial toxicity, and really acknowledging it as a side effect of treatment. So many of the people in the audience today may be sort of familiar with these issues that cancer patients and their caregivers and families are dealing with. And financial toxicity is sort of a more recently coined term, and I'll kind of describe to you how that came about. And so I'm kind of hoping to provide a broad overview, tell you a little bit about research that's just generally been done on this topic, including some that's been done here, talk about what we can do at the various levels to sort of address this problem for patients, and talk about some additional opportunities that people may be interested in. So, and then I also put Dr. Maria Pisu on here. I collaborate a lot on my research projects on this topic. She's also here at UAB at Division of Preventive Medicine. So this talk has been sort of growing as we've developed our work. So I just wanted to acknowledge her contribution as well. And hopefully this will be about 20-ish minutes. And then I'm definitely excited to answer any questions people may have. Okay, so this is a quote, and I have a few of them kind of scattered throughout the talk because I just think they're really powerful. So this was in a study talking to breast cancer survivors about how they felt like they learned about their cost of care and how they wanted, to talk to their care team about their cost of care. So this quote is from a breast cancer survivor. She says, "Everything's just going so fast. And believe it or not, when I found out I did have cancer, after you get over the initial shock of finding out that you do have cancer, the second thing that's going to go in your mind is, how am I going to pay for this?" So that, seemed very relevant to sort of this topic and how important it can be for patients who are already dealing with a lot of stress due to a new cancer diagnosis. Oops, sorry. Okay, so thinking kind of broadly, what are the costs truly of being sick? So I like to divide it sort of in categories because it makes it easier to sort of remember and understand. So starting over on the left, first, there are the direct costs. So these are things that are, what are the costs to receive care? So when we think of that, it could be medical costs. So things many people are familiar with, co-payments to see providers, co-insurance, which is paying a percentage of the total costs, medications, which could be anything from the chemo drug or, nausea medicine. Then there are non-medical costs that are still required for receiving care. So these include things like transportation to and from appointments or tests, parking, lodging for patients who may stay really far away or have really intensive treatments. Radiation is a great example because patients often have to have daily treatment. So often lodging can be a really significant cost if there's not a good resource to help them. And then not only monetary costs, but there can also be time costs. So this is the time that takes to travel to and from appointments and wait at the doctor's office or wait for testing. So this can really add up, and anything that a patient or their caregiver is doing, time on their medical care, they're not able to have time, working if that's what they normally do, providing care for other family members. And that again is for patients and their caregivers. So the second broad category is termed indirect costs. So these are more costs that aren't necessarily directly to receive care, but more are just for patients who are potentially feeling ill from their cancer symptoms or from side effects of their treatment. So it's not that they're trying to go to appointments, but maybe they actually can't work during the entire duration of their treatment because of how intensive it is or how serious their side effects are, and not being able to comply with their responsibilities at their employment. So that's a big example there. And then the last one, which is just as important, is the psychosocial cost. So really, what is the impact on patients' physical, emotional, social, and functional quality of life? So this quote is from an ovarian cancer patient from a study where we talked to patients who were experiencing financial distress to, again, learn about the process that they were using, coping strategies, et cetera, to deal with their cost of care and some of the actual sacrifices that they had to make for it. So I thought this one was very pertinent to kind of demonstrate all the different types of costs patients are dealing with. So she says, "I don't even know how to explain my out-of-pocket costs. That would consist of course, transportation. That would consist of medication because my insurance doesn't cover that. Some of it does, but not all of it. That would consist of, I have a good many side effects from the chemotherapy, and that requires different things. Going to have to see different doctors. Let's see, different kinds of foods that I have to eat now. I don't know how to put a cost on what it does emotionally. I don't even know how to put a cost on that." So you can see it's really affecting patients in sort of all three of those big categories. So when we're thinking about what are the monetary costs for patients along the care continuum, this was a review paper that was written by my collaborator, Dr. Pizzi, who's here at UAB, as well as several other authors listed here. And so in general, when they reviewed the literature about what might be the total costs, again, this is not out-of-pocket cost yet, but for a patient who is diagnosed with cancer in the first year, it's thought that the total cost might range from $20,000 to $100,000. And then importantly, these costs actually continue into survivorship, where patients may be continuing to deal with the side effects of their treatment and have ongoing medical needs specific to the fact that they had a cancer diagnosed previously, even if they may be in remission at this time. So those costs are thought to be about $1,000 to $30,000 per year, pretty broad range. And then finally, towards the end of life, costs may escalate more as the patient is more symptomatic and may need more resources to sort of deal with everything that comes along with that. So when they looked at all the literature, it seems that when we're thinking about patient out-of-pocket costs, which is really what we're focusing on today, it's thought that about 7 to 11% of these total costs are being, put on patients, and therefore it really can cause a lot of strain or financial hardship potentially for patients, as you can see, because these are pretty high estimates. So even 10% can really represent a high burden on patients. So some of the trends that are ongoing that really are contributing to the fact that this is becoming an increasingly bigger problem. So one of these trends is increased patient cost sharing. So in general, in the United States, healthcare costs are being increasingly offloaded onto patients. So this goes along with rising premiums in addition to rising out-of-pocket costs. So I thought this graph was pretty illustrative. So I'll kind of take you through it. So on the bottom of the graph, it's years from 2010 to 2020. And then on the left side is percentage increase since the starting date of 2010. So kind of looking at the gray line, which is here on the bottom. So inflation went up about 20% over this time period. Workers' earnings, so wages, went up only a little bit more than that, so 27%. But you can see when we look at the percentage increase in family premiums, so premiums, the monthly cost that you pay to have insurance, went up 55%. And then deductibles, which is the amount typically patients are paying totally out of pocket 100% until they meet a deductible. And then at that point, the insurance may kick in and start paying for some of the portion of the healthcare costs. You can see that's risen 110%. So clearly, healthcare costs, the amount that patients are paying is rising faster at a faster rate than workers' earnings or even inflation. Another trend that's really contributed to this problem is the rising cost of newly approved drugs. So this graph, I think, is pretty representative. So again, looking at the bottom is time from 1965 into 2020. Each of the blue dots represent an individual cancer drug at the time that they were approved by the FDA. And then along the up and down axis, the y-axis, you can see the monthly cost of treatment. Again, this is total costs. And it's actually on a logarithmic scale. So the first it goes to $10, then $100, then $1,000. So each little tick mark is 10 times the last mark. And you can see this overall trend where the line is really increasing, and thinking about the fact that each line goes up by 10 times, you can see that the cost of newly approved drugs is just skyrocketing. So you can see here in 2020, most of the blue dots, so newly approved drugs, are in the range of $10,000 or maybe even $100,000. And this is a monthly median cost, so quite exorbitant. Another trend that's occurring is a shift to oral therapy. So as some of the people in the audience may be familiar with, a lot of the traditional drugs previously were through an infusion. And so the big difference here is that infusion drugs are often delivered, in the vast majority of cases in an outpatient setting where a patient, may pay just a copayment and then get the infusion. But oral cancer drugs are actually covered by pharmaceutical prescription drug coverage, which is totally different. And a lot of the times, patients actually have more out-of-pocket costs or higher patient cost sharing for these oral drugs. Similar to sort of the overall drug trends, really a lot of these newly approved oral drugs for cancer cost in excess of $10,000 per month. So covered by a totally different part than just sort of the normal medical benefits. And if we think about even a patient who has 20% coinsurance, say for a $10,000 per month drug, that would still result in an out-of-pocket cost that could be as high as $2,000 per month. So again, another trend that's really contributing to this. So I kind of alluded to the fact that this problem is not new to cancer patients, but the term financial toxicity is a little bit newer, probably coined in the last 7 to 10 years, and really gaining steam probably in the last 5 years. So when we think about a toxicity, that's one of the medical terms we use for a side effect of treatment. And so over here on the left, you can see these are just some common side effects of, for instance, chemotherapy. So a provider might, or oncologist might tell a patient, okay, I'm going to prescribe this drug. You may experience hair loss, you may experience fatigue, nausea, vomiting, low blood counts, a rash, numbness or tingling in your hands and feet. But something that really healthcare providers in the healthcare system are not as good about talking to patients about, but we're hoping it's improving with time and will continue to improve in the future, is discussing that one of the additional side effects of treatment and cancer care in general is all of the, both monetary and time costs that are associated with cancer care. So again, thinking of this as a side effect or toxicity of treatment. So thinking about this as a broader concept, so financial hardship is a term that's often used sort of in the research realm, but I think is very relevant in the clinical setting too. So researchers have tried to look at, okay, so patients who are experiencing either high out-of-pocket costs or some financial hardship, depending on their financial situation at the start of treatment, which can vary. What are sort of the downstream effects that patients may be experiencing? So they thought of, it's basically been described these 3 sort of domains, which I think really illustrate sort of why we care about this problem. So the first one I'll start with over here on the left in the olive box. So patients are going to have a psychological response to this financial hardship. So things that that patient in the quotes we're talking about. So maybe worry about the ability to pay for care, distress, worrying that if I can't pay for payment, does that mean I'm not going to get the best, or can't pay for treatment, does that mean I'm not going to be able to get the best treatment available? Anxiety about the burden that it might put on patients and their families. Even potentially, after they've completed their treatments, they may still have, debt or go bankrupt, feelings of isolation or feeling like a burden to their family or other caretakers. On the top, darker green, we have impact on material conditions. So clearly money or time that's being spent on medical care can result in out-of-pocket costs, patients or their caregivers missing work, which can then really result in reduced or lost income. Patients may go into medical debt, and then bankruptcy, which medical care is actually one of the #1 causes of filing for bankruptcy, personal bankruptcy. So. And then finally, in the lighter green box, we have coping behaviors, which these are really focused on what the impact is on the patient's medical care in general. So because of this financial hardship, patients may actually delay or miss medical visits, or they may not take medications as prescribed. So it has been described particularly for oral therapies, patients, not refilling medications when they need to, taking half pills in order to make the pills pass longer, et cetera. And clearly that's going to have a potential negative outcome on the patient's clinical outcome for their cancer. So as a healthcare team and as patients and family members, this is really important in trying to target this issue so that that doesn't occur and patients can have the best outcome possible. So I've kind of mentioned caregivers here and there, and I just really wanted to emphasize the impact and role that caregivers play. And I thought this quote from another ovarian cancer patient in the cost study was really powerful. So the patient is saying about their caregivers, so I have to have someone drive me because I can't drive now. And so they're trying to, my husband will try to take some time. So is my aunt. She taught me about the Family Leave Act. So my husband, has to fill out paperwork in advance to be able to come and take me to the doctor. If my mother is feeling well, which she has cancer also, she'll try to bring me. And my sister, she's let her business slide, trying to bring me at times. And now, she's a realtor, so she just tells them she can't come. So you can see here, there's 3 to 4 different people that are kind of helping the patient even just get to their appointment. And a lot of sort of downstream effects and impact that those people are having on their life and even livelihood and income earning potential. So if we think back to those domains, myself and Dr. Pisu, who I mentioned previously, we have tried to study how our patients here in Alabama and sort of the southeastern region are being impacted by this. So a review first of sort of patients across the United States found that about 65% of cancer patients experience a psychological response due to financial hardship. 50% are experiencing sort of those downstream, not making as much money, not being able to work, so impact on their material conditions. And about 45% of patients are reporting coping behaviors due to their cost of care. Now focusing down in the southeastern region here, At UAB, we found that about 50% of patients are facing financial hardship among GYN oncology patients and among patients starting a new line of therapy, and it might have been new or recurrent disease. And then ovarian cancer patients surveyed throughout Alabama and Georgia, half of them worried about treatment costs, and about 40% were actually worried about using all of their savings or their retirement to pay for care. So this is at least, half of patients are dealing with this when we've been studying it. So it just shows kind of how rampant and how important it is. So when we think about who are the people who are most impacted or most at risk, so first is we found that younger age actually is at higher risk for experiencing more financial hardship compared to those over 65. Part of that may be because 65 and over patients have Medicare, whereas younger patients may be relying on employer-based insurance, which can have issues during treatment, or be making money and not have Social Security, et cetera. Women are more impacted in general when we've looked in the literature. Patients who are race ethnicity that are not Hispanic white, they seem to be more at risk. Patients who are closer to their diagnosis initially appear to potentially have higher costs burdens initially when they first are diagnosed, which kind of makes sense. The treatment may be more intensive at that point. Patients who are unemployed. And interestingly, we found in general, there doesn't seem to be a difference by insurance. So I really like to emphasize, just because someone has insurance doesn't mean that they can't also be experiencing financial hardship. There are clearly patients who are uninsured who are going to have a lot more challenges, but there is definitely a trend of underinsurance, which again is where patients are really having to pay for a lot of their own care out of pocket rather than the insurance covering it. So a few things I want to talk about, not just kind of the problem, but what are some strategies that we can do at various different levels to address financial toxicity. And this is sort of just a broad overview. Happy to answer questions if people have more specific questions on this. So I kind of broke it down on each level. So at the level of the patient, what could we do? The provider, the health system, the community, and then on a health policy level. So at the patient level, we really want to make sure that we're empowering patients to feel comfortable discussing issues related to their costs of care. Know that we're going to maintain confidentiality and privacy, and that at the end of the day, we want to reassure patients that we either have something that we can help them to find assistance, and that they're still going to receive, they're not going to receive different care because they can't necessarily pay for cost of care ideally. So from a provider standpoint, we want to be able to feel comfortable, myself as a provider, screening for financial distress. So bringing it up as part of our counseling session to just screen and make sure the patient doesn't have any financial concerns, feeling open about discussing costs of care. Going back to screening just for a second, there are actually tools that can be done probably more at the health system level, where there could just be routine questions similar to when patients, check in and are asked, have you had any recent falls? Have you traveled? Similar thing. Do you have any concerns about the cost of care? And then helping to triage patients to referral services for financial assistance services. So that's another thing we can do at the provider level. That could include anyone from social workers, financial counselors, lay navigators, nurse navigators, financial office if that's available, community groups such as the ones that have sponsored this. We can hear there's a lot of advocacy work being done. At the health system level, we need to have organized financial navigation services. So again, a proactive system that's identifying patients who might be experiencing financial hardship and then linking them to available services and helping them know who to contact if a new issue arises later. The community is going to be really important. So helping patients to tap into their social support networks, whether it's a survivorship group, talk to other patients who have gone through a similar thing and might have tips and tricks that they can provide. I know a lot of my patients have actually told me really positive things about learning how to get through all of these financial hardships from other cancer survivors. And advocacy groups who may be helping to fund programs that provide financial assistance to patients in the community. American Cancer Society, another well-known national organization. And then on a health policy level, improving cost transparency, because I think one of the issues that providers and health systems have is actually pretty hard to estimate ahead of time what the out-of-pocket costs are going to be for patients, because it's not very transparent and it's really different depending on people's treatment and insurance. Clearly, if we could somehow reverse the trend toward increased patient cost sharing so that other sources of payment, for instance, the insurer kind of holding more of that load, that could be helpful to patients specifically. And then drug pricing, as we saw, there's lots of trends that drugs are very expensive, and that's kind of beyond this talk. But if there's a way to sort of have a sort of more equitable, fair drug pricing strategy that may be helpful, again, on a health policy level. So I just, one or two more slides here, and then we'll open up to questions. So I just wanted to describe some current work that we're doing actually here at the O'Neill Comprehensive Cancer Center. So because it can be, we want to really normalize talking about this topic. Also recognizing that patients and providers, may have a limited time when they're counseling, and that a lot of that may be focused, for instance, on, what are the treatment options? What are the side effects? What is the clinical benefit going to be to me? Our thought is that really, if it becomes a routine part of cancer care delivery, or, the appointments that patients are going, what if we routinely screen patients for financial hardship so that it's kind of a universal thing? So we're actually piloting that in our gynec clinic, asking sort of a checklist of like 10 categories of difficulty affording certain categories. So anything from utilities to transportation to medications to co-payments. And so we're trying to figure out, what is the best screening tool? Do we need to do more than one screening? Because there are a lot of distress screenings and social determinants of health screenings that are already being conducted in the health system. So is it overlapping, or actually these tools valuable on their own? Is it acceptable and helpful to patients? And then knowing that the patient themselves is kind of going through a lot and may be overwhelmed by some of these questions. Our other question is knowing that caregivers are really intimately involved in this portion of patients' care. Could we actually screen caregivers for financial hardship? And would that help us to identify more patients and link them to resources? So this is something that's actually been being funded by the National Cancer Institute, and we're about halfway through the project period. So we'll be excited to see and learn from our patients who are going through this, what they find the most helpful, and what we should remove to not sort of have too much burden on the patients. And sort of the last slide is actually a plug. So through University of Alabama, Birmingham, and then the University of Tennessee Health Science Center, we actually were funded also by the National Institutes of Health to form a research network. So the research network is called the Emotional Wellbeing and Economic Burden Research Network. So for short, Emoticon, and you can see our logo here. So the overarching goal is really to stimulate research on the impact of the economic burden of disease. It's not just cancer, actually, we want to expand a bit beyond cancer, but probably the most is known in cancer compared to other diseases like Alzheimer's, heart disease, et cetera. And we really want to focus on, okay, the economic burden of disease we're learning more about, but what is the impact that this is having on patients' emotional well-being? So you can see our LinkedIn and Twitter handles here. We're really looking for a diverse group of stakeholders. So it's not just for researchers. We're very interested in having members that are maybe patients, caregivers, stakeholders like social workers or financial counselors who are really in the trenches trying to help link patients to resources. And those people, even if they're not conducting the research, will really be able to provide valuable opinions about what are the important questions or gaps that we need to fill in with future projects. So I would encourage all of you to check us out, and we would love if you would join our network if it's interesting to you.